It's all about balance. So if you have the protective estrogen to balance out the bad one, you're actually going to be protected. Hi, welcome this week to the Naked Doctor Show. I'm Dr. Tammy.
And I'm Dr. Debbie.
We are the doctors. We have a great show for you today. We're going to do all things hormones. And immediately when people hear hormones, they shut off and they say, estrogen cancer. So we're going to dispel some of the myths for you today and talk about that. And I think one of the beautiful things is that Deb and I both have that experience being menopausal women.
Right.
And so many people are challenged with that, and so many people don't get help, and they kind of shut down because they think there's nothing I can do, because the traditional world says, you know, you can't have hormones, or you can only have hormones if you're really, really hot flashing, or really symptomatic.
Yeah, not look at the lifestyle, quality of life.
So tell them a little about yourself, because you're kind of new on this scene.
Yes, I am. So I'm a certified registered nurse anesthetist, meaning I have a doctorate in nursing practice with specialization in anesthesiology. But through my journey, I obtained a biology degree while doing my master's. So I have an interest in hormones.
I love it. So what was the first point that made you seek out what we call bioidentical or natural hormones?
Purely through struggle, basically, and seeking conventional medical help with things that I really didn't see as normal in my late 30s, but predominantly just feeling different and not having the energy level, really having a different body weight distribution than I had traditionally had, and actually feeling a little bit crazy. So
same. That's what drives everybody in this office. Yeah.
And of course they'll agree with you that you're a little bit crazy. So you have to be careful sometimes what you go in and seek, or where you seek help, and not to accept that as your everyday life.
I tell our staff when people come in the first time, don't judge them. Because they'll be different the next time they come in, I promise.
You'll see a metamorphosis.
It's like kind of like those hairy cats, you know, that are like all that big hair and all frazzled and stuff. And I get a lot of husbands that send their wives in. So and you know, I think that's honest and that's real. I mean, you never want to make anybody feel bad, but I think it can be really helpful when someone says, you know, maybe, you know, you're not feeling your best, and I've noticed you've been tired or something. So there's a way to have that dialogue that really fits into not hurting someone's feelings and
exactly. Yeah, it should be looked at as fostering someone's health, not criticizing them.
Go.
Exactly.
So we're going to talk about all that and more. We're going to dispel some myths, and if you stay to the end, we've got 3 things that you can start doing today to start achieving that hormone balance that you might feel a little out of balance with now. So stay tight. We'll be right back with the Naked Doctor.
In 2007, I was in an auto accident. A lady ran a red light and hit us, and I got a traumatic brain injury, and I got herniated and collapsed and compressed discs in my upper and lower back. She's been using stem cells, and she put the stem cells in my ankle the first time, and up until that, I had been completely on the cane. I couldn't get around without the cane because it was that bad. Yes, I just got my first dose on Friday, and today is Tuesday. And after the accident, my brain was so hot. Inside my head was always hot, and that contributed a lot with the headaches. And after I got the stem cells on Friday, my head is so cool, and the inside is cool, and I just feel so enlightened and awake, just more alert all the time. And it's like they keep working for 3 months, and I'm just so excited to see, okay, in 3 months, if it's this different and amazing already, what's it going to be in 3 months?
Hi, welcome back to The Naked Doctor. I'm Dr. Tammy.
And I'm Dr. Debbie.
We have a great show. We're talking about hormones. And it's so funny because every time I say we're talking about hormones, well, and honestly, every show for me could be the hormone show because I always kind of weave it in somehow. But this is all things that we're kind of talking about, female and perimenopausal, and all the hormones even really start kicking out of balance when you start menstruating, really. And so it's a whole gamut from that to 70, or as long as you want to be vibrant. And so when I hear, or someone's introducing me and they say, oh yeah, she's a hormone girl, hormone queen, and it's like the first thing I hear is, I can't take hormones because I had breast cancer or my mom had breast cancer. And immediately the conversation just shuts down, and you feel like you're having to really explain and make an excuse for the reasons why the science is so off. I think that's one of the things I love about you and our conversations. And it's kind of cool because the first time I met you, I was like, oh, you're my tribe. You get it, right? And you already came to me already knowing, and I'm like, this is the easiest thing ever.
Your sales pitch.
Yeah, exactly. So it was just really easy, and we've talked about one day I want you to come take over what I do too. So I'll retire and you can do all the heavy lifting. No, we'll do it together.
We'll do it together.
But yeah, so they hear that, and so I like to just start that conversation with estrogen is not the only hormone. And when you hear the word hormone, I would just ask you that you kind of consider that there's thyroid,
right,
insulin, cortisol, all these different things that are drastically impacting you. And one thing I would say too with menopause is when you hear estrogen, you hear hot flashes. And we're talking a little bit about before the break that there's mood and
right,
feeling crazy, and the weight gain. I find that people that come to me that haven't really explored natural hormone therapy, they've gained 5 to 15 pounds a year, or if they have a hysterectomy and they've don't have ovaries anymore, and they just slap an estrogen patch on them without the other balance of all the other hormones. It's a bad deal.
Well, and just the impact on, we've mentioned things that are obviously uncomfortable, hot flashes, weight gain, but also the real physiological impact on things like your cardiovascular system, your bone health, things that are beyond just lifestyle. They're, pertinent to your longevity. So.
And as I get closer to I always think of it think about holding 70 pennies in your hand, right? And so that's not that many pennies. And I've spent 50 of them now, 52 to be exact.
I've spent 59.
So it just looks amazing. Oh, it's crazy.
I don't have many.
See, we're the testament. We're the testament to hormones, right? And in fact, it was funny because I'm rabbit hole today, but we were at the DMV, and my son's 17, and he's getting his license, and there's this guy sitting over behind me, and I swear he looked like an old man. He looked like he was in his 80s. And so we're talking, and we were talking about 80s music and stuff, and our age, birthdays, stuff like that. And he's like, oh yeah, because I said I was born in 69. He said, I was born in 60, or I was born in 70. And I'm thinking, oh my gosh, what happened? Or high school reunions,
right.
And you're looking around and you're like, oh, you should have found me a long time ago.
You thought you showed up to the wrong class,
yeah,
didn't you?
And I'm not bragging. I'm just saying, the beauty of being informed, and the aging process doesn't have to be the outside or the inside as much as.
Well, and a lot of youthfulness versus appearance, I think, is energy level and positivity, and hormones impact all of that, potentially more than appearance and things that, magazines will have you worry about, but
Well, and you think about every hormone that, affects all that too. And I always tell people, when you walk into the nursing home and you see an elderly person, every process is a hormone process. Well, hormones dictate everything because they're just chemical messengers that tell your DNA and your proteins what to make and how to make them. And when your DNA starts getting tired and breaking down, your hormones dictate your immune system that repairs it too. So your skin repair and wrinkles, everything you see in a nursing home, from broken hips. And I always say my mom had 3 broken hips. She broke one twice, and it took her out of the game. Her mobility was gone. I mean, she had to like scoot around in a little wheelchair. And it's like, people don't understand that longevity is related also to your independence.
Yes.
Like, how do you want to spend those last pennies?
Right.
If you've got 20, 30 pennies, do you want to spend them scooting around, with the legs off a wheelchair?
Right. And it's a cascade effect. You break your hip, well, then your back starts to hurt, and on. And maintaining your muscle strength, your flexibility, all of that relates to your hormone balance.
And balls.
Yes.
And continence, because it's the estrogen effect on the elasticity of the urethra.
Yeah. Exactly.
So all those things, so from wrinkles to the very inside.
Yes.
It's crazy. And so we'll talk a little bit about, and I'll do a little chalkboard segment here in just a little bit, and kind of explain how hormones are made from the cholesterol molecule, which cholesterol is actually a hormone. People sometimes don't know that.
That's right.
I always like to share new information. But the balance between, there's different kinds of estrogens, so I'll share that with you as well. So there are protective estrogens, and then there are more stimulatory type estrogens, which is fine if you're a 9-year-old girl trying to grow girl parts. Not so good if you're a menopausal female, which does increase your risk of cancer. And so there's a lot of myths around, the WHO trial and things like that, and that happened that scared us from hormones. And you have to just get outside the box a little bit. And I feel like, not to knock our colleagues, but there's a little intellectual laziness. And the training that we go through often is learn the drugs, learn how the system works, learn.
Right. Well, and not just to work off of only an algorithm, which is something you do an excellent job of, is to look at the whole patient and tailor hormone replacement based on history and based on symptoms and your lab values. That's protective versus throwing a synthetic estrogen, one size fits all. I think that's where people, and where the studies have kind of interjected that fear of estrogen from.
It's all about balance. So if you have the protective estrogen to balance out the bad one, you're actually going to be protected. And I have breast cancer patients that I have on the, quote, good estrogen. I don't believe God makes bad estrogen, but, and they feel better. They feel good. They feel normal.
Right.
And we see that all the way through, I see girls as young as 9 that sometimes I'll put on a little cycle natural progesterone just to make their periods calmer. And, it's funny, when I was a kid, we didn't talk about that.
No.
That was like taboo, and our parents didn't talk about that with us. And so, I thought back then, as I went through endometriosis and PCOS and all these personal issues, which I believe were for me, not done to me, right? Because I get to experience this now, but
You benefited. Everybody else benefited from your journey.
Yeah, and they're benefiting from you now because you've had. But it's nice with the vulnerability to say me too, and people open up to you more. And actually, being the word doctor in Latin means to teach, and really it's to teach and share. But at the end of the day, it's all about relationship and
empowerment.
And empowerment, absolutely. I know you're big into education and supporting and just being very active in your profession. I mean,
people are fearful when they don't understand things, particularly in anesthesia. So I get to try to alleviate those fears in a short amount of time, whereas you get to build a lasting relationship, and that's a true benefit of this type of treatment, and holistic treatment.
Yeah, if you can help people understand, it's going to be such a better journey and just build that relationship too. All right, we're going to take a little break and we'll be right back with the Naked Doctor, and we're going to talk all things hormones just a little bit more.
Hi, welcome back to The Naked Doctor. I'm Dr. Tammy. We have your whiteboard segment for you, and I'm going to be talking about hormones a little bit more. And when people hear the word hormones, they immediately hear the word estrogen. But I also want to point out that there are literally hundreds of different hormones in the body, from thyroid, insulin, there are fat burning and fat storing hormones. So there's so many that you need to know about. But when we're talking about male or female steroid hormones, here's a few things that you might not have heard before that you might want the perspective on how to look at them just a little bit differently, and that it actually could save your life. So one of the things that people immediately go to is estrogen. But if you think about who gets breast cancer, because they think estrogen and then they think breast cancer, if you think about who gets breast cancer, it's usually the menopausal females. So a young girl has about a 1 in 20,000 chance of getting breast cancer. A menopausal female, when her estradiol is the absolutely lowest that it's probably ever been in her whole life, has about a 1 in 8 chance of getting breast cancer. So if you just use common sense, that just doesn't add up. So I'm going to show you different kinds of estrogen and why that actually is. So it's the same thing with males and testosterone, and males and females have all the same hormones. So this is relevant to females as well. But if you think about in a male, the prostate is the embryological equivalent to the breast in the male. And who gets prostate cancer? Is it the young boy who's 17, or is it the elderly male whose testosterone are the lowest they've ever been? But yet in mainstream medicine, we still go off those myths, and those are things that perpetuate to this day, even though the science doesn't add up, and the science has been actually proven why that is. Okay, so I'll just be kind of basic here. And so basically your body takes cholesterol, which is actually a hormone, which is a steroid hormone. And that cholesterol molecule turns into a hormone called progesterone. And there's a lot of other hormones that are breakdown metabolites along this pathway. I'll keep it really simple though. And progesterone stands for progestation, which is pro-pregnancy. Gestation is pregnancy. And so this, men and women, remember, have all the same hormones. Men don't get pregnant, of course, but men also need progesterone, just like women, for sleep and mood and fluid blood pressure balance and all sorts of things, energy. So there's all sorts of things that people need progesterone for, both men and women. Then progesterone converts into, just for simplicity's sake, I'll say estrogens. Okay. And then that converts into, for simplicity's sake, again, testosterone. And there's 3 different kinds of estrogens, main metabolites of estrogen, lots of different kinds, but we call them E1, E2, and E3. So E1 is a more problematic estrogen called estrone. And it's not a bad estrogen, but when you have too much, it can be proliferative, meaning growth. And if you're a 9-year-old girl or a 9-year-old male trying to grow a breast or a prostate, you want plenty of estrone. It's a growth hormone as far as estrogens go. However, when you're menopausal, growth can then mean overgrowth, can then mean tumor, can then mean cancer. So knowing what your estrone levels are could actually save your life. Very important. Then E2 is something called estradiol. And estradiol is a neutral estrogen. It's good for bone density in both men and women. You don't want to break a hip when you get older. It's also good for mood. It's also good for all sorts of fat metabolism. So if you don't want to get overweight after menopause, or we call it andropause in men. If you want to regulate your heart and have that be healthy, and your brain so you don't get Alzheimer's, your skin, if you don't want to get wrinkles. So estradiol is very, very important to protect the collagen in your skin. If you think about anybody in a nursing home that's elderly, it's usually a drop in estradiol. And when I check my menopausal females, their estradiols are almost 0. It's crazy how little estradiol people function on as they get older. If you look at someone in the nursing home, you will know that all of those things you see are, quote, a part of aging, right? So you don't have to accept aging. I say better living through chemistry, because you can use bioidentical hormones and get this balance So the things you see like incontinence or collagen breakdown in the urethra from lack of estradiol, the bone height loss and they get hunched over, they break a hip or they're wrinkled skin, all that is a decline in hormones. So it's really important that you get that balance. Now here's a really cool thing, and that is that E3 is called estriol. And estriol is actually a protective estrogen because it can bind up all the receptors on this estrone, which is more problematic for the estrogen receptor positive breast and prostate cancers. So you want lots of estriol. So you can give somebody estriol all day long, help with their hot flushes, their symptoms, even if they've had breast cancer, help them feel better, balance it out with their progesterone, give them some testosterone, and it's amazing. And they will feel so grateful because they're told from mainstream medicine that there's nothing they can do. And even if you don't work with these hormones, you can also work with thyroid and insulin and cortisol. So you don't have to settle for feeling bad, and you don't have to settle for someone just throwing pharmaceuticals at you, or worse, telling you that there's nothing they can do. And I'll also add that yes, women can also get testosterone therapy. It not only helps with the libido or the sexual energy, but it also helps with building muscle, which will burn fat for you, and will also help with energy levels and weight metabolism. So it's absolutely very important, and you don't have to suffer in silence. So hope this was helpful. Hormones 101, and we're going to be right back with the Naked Doctor Show.
I fell 18.5 feet, scattered my right ankle into 23 different pieces. And that, of course, affected my knees, which affected my hips. And then I have a back injury and a neck injury and a shoulder injury. And I was in severe pain most all day until I could actually lay down and get off of my body. The stem cell therapies within hours actually turned around to where I felt like almost 90% of the pain in my body was gone. I could walk. I could walk without pain. I then came back and did a stem cell IV, which came in and affected all of the other parts of my body. And at one time I was a smoker. Since then I have felt a large difference in my lung capacity, in my breathing, in my stamina. It's the most amazing thing that I've ever come across in my life. And one of the things that I say is you will love Dr. Tammy. She is the sweetest person you'll ever meet, and she is not your typical doctor. She makes you feel like you're at home. She actually gets to know her patients, knows their lifestyle, and tries to work her treatments with your lifestyle so that you are happier and more productive on what you're doing.
I have osteoarthritis, and the arthritis medication that you get regularly will cause your kidney function to go down, and my kidney function had started going down, and so I knew I needed to do something different. I've been seeing Dr. Tammy for about 3 months, and she's been doing stem cells in my knees, and it's like a miracle. She absolutely hits it every time in the correct spot, and I am pain-free now, and I haven't been pain-free for about 10 years. I can go upstairs without pain. It's wonderful. And I send everybody I know to her because she's done such a wonderful job for me, and I just appreciate it so much.
Welcome back to The Naked Doctor. I'm Dr. Tammy.
I'm Dr. Debbie.
We've had a great conversation today, and I've just loved you being my new gal, my little sidekick, the doctor show. Oh, it's just the two of us. So I promised that we would do 3 ways that you can start balancing your hormones. And number 1 is ask questions, get informed, do your research. That's just, I know that sounds like a little bit ambiguous, but really it does start with education and then empowerment. Find people who have answers for you. And number 2 would be evaluate your current situation. Are you sleeping? Are you eating the wrong things? Are you eating a lot of sugar? And we're going to do the sugar show.
Yes,
that's coming up. Yep. So you'll want to watch for that next episode.
It's sweet.
It's sweet. It's really sweet. We're sweet. And so, if you drink sodas, that's the biggest thing I tell people, or sweet tea. Usually sodas are like half the solute to liquid, right? So if you drink, you remember when you made Kool-Aid as a kid, you put 2 cups of sugar in a quart?
Yes.
I mean, it's tons of sugar. So just little baby steps like that, try cutting out those kinds of things. And, and the rest of it is supplements and inventory of good sleep hygiene, and get that sleep, and don't overstress your life where you're doing so much that you have nothing left for yourself and you're not sleeping well, because that throws everything off.
It becomes a cycle, a vicious cycle.
It does, and then you're cortisol, and then you're tired, and then you're tired and
then
you're
you
not
want
productive. Then you want sugar. Exactly. So not the sugar show, but just some little things like that. So, and just because you're not a doctor, you don't have a biology degree, doesn't mean that there's not lots of information out there that is written that, you're an expert in your own field. We are experts in our stuff, but that doesn't mean that you can't ask questions and you can't have informed, educated dialogue. So that would be probably the most important thing that
Absolutely.
I would say we'd leave you with. So we've had a great show. We want you to come back next week, same time, same bat channel. And check us out, our Facebook page, The Naked Doctor Show. You can also check us out. We have a website, thenakeddoctorshow.com. We're on Instagram. We're on pretty much all the social media, so you can find us there. Please leave comments. Share with us content that you'd like to see on the show. You can also email us at drtammy@healingartscenters.com, which is my day job.
That's right.
And come see us. Get your levels checked. I mean, that's one of the most important things that will really start you on your journey, because I always say the blood doesn't lie. And so when and a lot of doctors don't do all those labs, they'll just do a cholesterol. Well, that doesn't tell you anything. You need to know your estrogen levels, your testosterone levels, and it could literally save your life, if not increase the value of your life. So check us out. Join us again next week on The Naked Doctor Show. Until then, we love you. Have a blessed week. Mwah.